Good morning to doctor and also our fellow friends. Today we'll be presenting about the opportunistic parasitic infection in immunocompromised patient, Cyclospora canadensis. Okay, as for my part, I'll be talking about the introduction, also known as the general characteristics of Cyclospora canadensis. So this Cyclospora canadensis is a single-cell intestinal parasite that causes an infection known as cyclosporiasis. So this parasite mainly infects human intestinal tract, and humans are considered as the main host. The infection occurs when a person consumes or drinks the contaminated water with sporulated oocytes, which are infective stage of the parasites. So after entering the body, this parasite will affect the small intestine and can lead to symptoms such as like watery diarrhea, abdominal discomfort, nausea, and also loss of appetite. Okay, so this Cyclospora canadensis is like a very important intestinal parasite because it can spread through contaminated food and water and can cause a significant gastrointestinal illness.
Next, we'll explore the morphology of. Next, we'll explore its morphology. So basically, its oocyte is a spherical colored structure measuring 8 to 10 micrometers, which makes it difficult to detect without specific techniques. It exhibits variable acid-fast staining, while some oocytes stain, while others do not. Under UV microscopy, the oocytes autofluoresce, which aids in identification. Each mature oocyte contains two sporocysts, each with two sporozoites, totaling four. The key development stages include the unsporulated oocyte, which is non-infective and excreted in feces, the sporulated oocyte, which develops in the environment and is infective. So understanding these stages is crucial for diagnosis and prevention. Next, we examine the life cycle. So in this slide, we're driving into the life cycle of the parasite that causes cyclosporiasis. Understanding this cycle is crucial for grasping how infections occur and how they can be prevented. Let's begin with the infective stage. The parasite's life starts when the sporulated oocyte is ingested. This is the stage where the parasite becomes capable of causing an infection. Once inside the body, the oocyte undergoes excitation, releasing sporozoites that invade the intestinal cells. This is followed by merigony, where the parasite replicates, and gametogony, where it develops into male and female forms. Fertilization occurs, leading to the formation of new oocytes. In the diagnostic stage, unsporulated cysts are passed in the stool. These oocytes are not immediately ineffective and require time in the environment to sporulate and become capable of starting the life cycle again. This sporulation happens outside the body, which emphasizes the importance of environmental factors in the spread of infection. So understanding these stages helps us pinpoint where interventions can be most effective, whether it's in preventing ingestion or managing environmental conditions to reduce sporulation. Next, I'll pass on to the next person.
So now I'll be talking about the diagnosis of the Cyclospora caryathenensis. So the first will be the stool microscopy, which is the main diagnostic method. A direct red mount is examined and unsporulated oocysts can be observed. And the next one will be the modified acid-fast staining, which is used to identify the oocysts more clearly. The oocysts will appear pink to red against a blue or green background in the modified acid-fast staining. So the lastly will be the PCR, which detects the parasite's DNA in stool samples and has high sensitivity, and this making it useful for confirming the diagnosis. And that's all from me.
Next, I would like to talk about the transmissions and epidemiologies of the Cyclospora caryathenensis. First, the Cyclospora is transmitted through the fecal-oral route, which the infection occurs when the persons consume contaminated waters or contaminated fresh produce such as berries, lettuce, and fresh herbs. So these foods are often eaten raw, which allowing the parasite to be ingested. The importance point is there is no direct persons-to-person transmissions. This is because the oocyst is passed in human feces are not immediately effective. They must be first undergo the sporizations in the environment before they become infective. So in the terms of epidemiology, the Cyclospora cayetanensis has a worldwide distribution, but is more common in the tropical and subtropical regions. The tropical regions is such as Malaysia and the subtropical regions such as China, where the warm climate and poor sanitation which increase the risk of transmissions. The foodborne outbreaks have also been linked to the contaminated imported fresh produce. In addition, the Cyclospora is an opportunistic parasite that can cause more severe and prolonged infections in immunocompromised individuals, which especially the patients with HIV and AIDS. Next, I'd like to discuss about the Cyclospora cayetanensis infections. The group high risk are immunocompromised individuals. This includes the HIV and AIDS patients with low CD4 plus T cells counts, and the cancer patients also receiving the case, and organ transplant recipients taking the immunosuppressive drugs, and lastly is the individuals who use the long-term corticosteroids. Then these patients are in adults have the weakened cells and cells-mediated immunity, which plays an important role in controlling the parasite infections. As a result, as their immune system have a reduced ability to clear the parasites effectively, this allowed the infections to persist for a long period, which increases the risk of chronic diarrhea and more severe disease. That's all from me. Thank you.
Now I'll be talking about why immunocompromised patients are more susceptible to Cyclospora cayetanensis infection. In people with a normal immune system, CD4 plus T cells play a key role in controlling intestinal parasites like Cyclospora. They help to coordinate the immune response and activate other immune cells. Macrophages also help by engulfing and destroying the parasite. Together, these immune cells usually allow the body to clear the infection effectively. However, in immunocompromised patients, such as those with HIV or AIDS, cancer, organ transplants, or those taking immunosuppressive medications, the number or function of CD4 plus T cell is reduced. This weakens the immune response, making it much harder for the body to fight the parasite. As a result, Cyclospora can survive in the intestine for a longer time because the body is unable to completely eliminate it. This often leads to persistent or recurrent infections, which are much more common in immunocompromised individuals than in healthy people. As shown in the diagram here, immunosuppression causes a decrease in CD4 plus T cells, leading to a poor immunity and eventually chronic infection. These patients may experience prolonged watery diarrhea, abdominal cramps, nausea, weight loss, and dehydration. Without proper treatment, these symptoms can last for weeks or even months. That's all from me.
Next, I will discuss the clinical manifestation of Cyclospora cayetanensis infection. First, in healthy individuals, the infection usually causes watery diarrhea, mild abdominal discomfort, and is generally self-limiting, meaning it resolves without long-term complications. However, in immunocompromised patients, especially those with HIV or AIDS or weakened immune systems, the disease is much more severe. Patients may experience chronic watery diarrhea lasting for weeks to months, severe dehydration, weight loss, malabsorption, malnutrition, and fatigue. If left untreated, prolonged diarrhea can lead to electrolyte imbalance and may require hospitalization. Therefore, early diagnosis and treatment are especially important in high-risk patients. That's all from me.
I'm going to present about the treatment and prevention management. So the Cyclospora cayetanensis infection is treated mainly with trimethoprim sulfamethoxazole or TMP-SMX, which is the drug of choice. The usual adult dose is 160 milligrams of trimethoprim and 800 milligrams of sulfamethoxazole taken twice daily for 7 to 10 days. This medication works by blocking folate synthesis in the parasite. Patients with severe diarrhea may also require oral or intravenous fluid and electrolyte replacement to prevent dehydration. For individuals with sulfur allergy, there is no equally effective alternative, and drugs such as ciprofloxacin has limited effectiveness. Prevention focuses on avoiding contaminated food and water. Fresh fruits and vegetables should be washed thoroughly, safe or boiled drinking water should be used. And good hand hygiene and food hygiene should always be practiced. Improving sanitation and proper sewage disposal also help reduce the spread of the parasite. That's all from me.
Now, in conclusion, Cyclospora cayetanensis is an important opportunistic intestinal parasite. While it usually causes mild illness in healthy individuals, it can lead to severe and prolonged disease in immunocompromised patients. Therefore, early diagnosis, appropriate treatments, and good hygiene practices are essential to reduce complications and prevent infection. That's all from our group. Thank you.